Welcome back to the deep dive. Today we're jumping straight into a topic that feels absolutely vital for the future of healthcare. How artificial intelligence is currently being used to help medical students.
Right, helping them prep for those incredibly high-stakes exams.
Exactly. And just as critically, develop the practical skills they'll actually need as doctors.
And the sources we're diving into today, they really focus on that specific intersection.
Okay.
Looking at AI's role in postgraduate medical prep and education.
Yeah.
So it gives us a pretty clear picture of the landscape.
So right off the bat then, the sources lay out some significant challenges with how medical students have traditionally prepared.
Yeah, they do. They particularly highlight the intense environment of postgraduate prep. The sources mention the Indian context specifically, actually.
Ah, okay. And what were the core problems they identified there with the traditional ways?
Well, you see the immense pressure, obviously, the sheer volume of material students have to learn, and the fierce competition.
Right.
But the sources also point out that these traditional methods can often become, well, heavily reliant on rote memorization.
Just learning facts.
Kind of, yeah. Students might get incredibly good at recalling facts for, say, a multiple choice question. But then when they're faced with a real patient scenario, they might, struggle a bit.
Yeah.
Struggle to connect the dots, to actually apply that knowledge clinically.
Right. The classic gap between knowing the facts and knowing how to use them in practice.
Exactly.
It sounds like that focus on recall, maybe in some assessment methods, can leave students feeling, fundamentally unprepared for the actual job.
Precisely. And coupled with that, the sources also bring up significant resource constraints.
Like what?
Well, not every student has easy access to expert faculty for really personalized guidance,
Okay.
Or maybe they don't have access to state-of-the-art simulation labs, or even just exposure to a wide enough variety of clinical cases during their training.
Right, which means students might graduate without enough, hands-on or even really good simulated experience.
That's the concern.
Okay, so this is where the sources seem to shift perspective quite dramatically.
Yeah.
They introduce AI not just as another tool, but as a potential solution, right? A powerful one.
Yes, exactly. A solution to these very real challenges. They frame it as a way to provide a personalized, interactive, and data-driven learning experience.
Something traditional methods maybe can't quite match.
Often, yeah. It's about tailoring the learning journey to the individual student.
How so?
By pinpointing exactly where they need help and offering practice in ways that, go beyond just reading textbooks or attending lectures.
That sounds like it could genuinely change the whole preparation process. So what are some of the specific AI-powered tools and systems that the sources highlight? What's actually being used?
Okay, well, one key type mentioned is intelligent tutoring systems.
Intelligent tutoring systems.
Right.
Like a digital tutor.
Kind of, yeah. Think of them as personalized digital mentors.
Yeah.
They don't just deliver information passively.
Right.
They adapt to how you, the student, actually learn. They track your progress, identify your weak areas, and provide explanations and feedback that are tailored specifically to your needs.
So if I'm struggling with, say, cardiology,
then the system can focus right there.
Yeah.
Offering different examples or maybe different explanations until you really grasp the concept.
That's a huge shift from, a one-size-fits-all lecture or textbook chapter.
It really is.
What else did the sources dive into?
Another major application highlighted is virtual patient simulators.
Okay, virtual patients. What are those exactly?
These are pretty sophisticated AI systems that create realistic clinical scenarios. You can interact with a patient, ask them questions, order tests, make diagnoses, even practice procedures. It lets students apply their knowledge and practice those crucial skills like diagnosis, communication, technical procedures, all in a completely safe environment.
That safety aspect, especially for practicing high-stakes procedures, that seems incredibly important, doesn't it?
Oh, absolutely.
I think the sources mentioned a specific example, something about a lumbar puncture.
Yes. They mentioned a resident who gained a lot of confidence for doing a lumbar puncture after practicing it repeatedly on a virtual simulator.
See, that really underscores the value of that risk-free repetition, making mistakes without consequences.
It really does. That ability to practice complex or high-risk skills without any real-world consequence is just invaluable.
Definitely.
And building on that idea of personalization we talked about,
Yeah.
the sources also explored how AI is being used to create personalized learning paths.
So not everyone follows the exact same track.
Exactly. Instead of everyone following the same curriculum at the same pace, AI can analyze a student's performance, their background, maybe their learning style,
Okay.
and then recommend a learning path that optimizes their understanding and builds confidence specifically where they need it most.
So AI is enabling a learning journey that's truly adaptive to the individual student. That's fascinating.
It is.
What other ways are the sources showing AI being applied in med-ed?
Well, beyond those, the sources also discuss AI for procedural skill assessment.
So not just practicing, but actually evaluating how well they did the procedure.
Yeah, evaluating how well a student performs a simulated procedure, and also clinical reasoning evaluation, assessing their decision-making process within a virtual case.
Mm-hmm.
And one particularly interesting application mentioned is AI-powered standard patient interaction systems.
Standard patient, like the actors sometimes used in training, but AI.
Sort of, yeah. These simulate realistic interactions you'd have with a patient in a clinic or, a hospital setting.
Okay.
It lets students practice their communication skills, work on building differential diagnoses based on a patient's history and symptoms.
And navigate those tricky conversations.
Exactly. Directly addressing that gap we talked about earlier, the one between theoretical study and real-world patient interaction.
So looking at all these tools, the personalized tutoring, the simulation, the adaptive paths, what do the sources say are the overall benefits for the student?
Well, the benefits outlined are pretty compelling. Firstly, it leads to significantly enhanced learning, mainly through these interactive and, frankly, more engaging experiences.
Makes sense.
It also directly improves those crucial skills, like clinical reasoning and patient communication.
Things that are vital but maybe hard to teach just from a book.
Very hard, yeah.
Yeah.
And this, in turn, leads to increased student confidence, which, is paramount for future doctors.
Absolutely.
And as we discussed, these tools help overcome some of those resource constraints.
By making simulated experiences more accessible.
Right. High-fidelity simulated experiences become more widely available. So the sources frame the overall impact as really transforming the learning journey itself.
Making it more personalized.
More efficient and ultimately more empowering for the student.
Okay, so let's say someone wanted to actually build a system like this, especially maybe in a context like India, as mentioned in the sources. What are the practical steps, the considerations? What's the blueprint here?
The sources actually provide a pretty clear picture of what that undertaking involves. Data acquisition is a massive first step.
Getting the raw material.
Yeah, getting access to digital textbooks, study guides, past exam papers, that kind of thing. And that might require significant partnerships, with publishers, with educational institutions.
Okay. And accuracy must be key.
Oh, absolutely critical. So integrating relevant clinical guidelines is essential.
Mm-hmm.
And the sources point out the need to include both local standards, like those specific to India perhaps, and international ones, to ensure the information is accurate and comprehensive.
So it's not just about digitizing books, it's about layering in verified, up-to-date medical knowledge.
Exactly right. And collaboration with universities is also vital. To gather anonymized data, like student exam performance, this helps train and refine the AI models, make them smarter.
I see.
And crucially, you need to engage experienced medical faculty and mentors. Their expert input is just invaluable.
For what exactly?
For validating the data, for one. Making sure the AI's explanations are medically sound, and also for helping to create those realistic virtual patient scenarios we talked about.
It really sounds like you need both the tech expertise and that deep medical knowledge working hand in hand.
Absolutely, you do. Then, of course, there's the actual model development, building the AI brains behind the intelligent tutoring, the virtual patients, the assessment systems.
The core technology.
Yes. And on the practical side, the sources stress that implementation needs to be user-friendly.
Makes sense. Needs to be easy to use.
Yeah, these systems have to be easy for busy students and faculty to actually integrate into their workflow. Pilot projects are recommended too.
Testing it out first.
Yeah, with medical colleges, hospitals. Testing and refining everything in real-world settings before a wider rollout.
And I imagine there are rules and regulations to think about.
Oh, definitely. Critically important. Rigorous attention to regulatory compliance is a must, adhering strictly to data privacy laws and, of course, medical education standards.
It's clearly a complex undertaking, requires a lot of collaboration, a lot of investment.
No question.
And, throughout the sources, there seems to be this consistent theme that AI in medical education, it isn't about replacing the humans, is it?
Not at all. No, the sources are very, very clear on this point. AI is presented as an augmentative force,
Augmentative, a meaning.
meaning it's there to enhance human capabilities, to act as maybe a tireless mentor or a realistic practice partner, but definitely not to substitute that vital human element.
So it doesn't replace the relationship between a student and their human teacher or mentor.
Absolutely not. Nor does it replace the absolutely crucial experience of working with real patients under the guidance of experienced clinicians. That remains essential.
So it's really about making the human educator and the human learner more effective, giving them better tools.
Precisely. That's the idea. The vision the sources paint for the future of medical education isn't just technological.
Yeah.
It's intelligent, yes, and adaptive, but fundamentally it remains human-centered.
This deep dive has really shown how AI seems poised to, well, profoundly impact the learning journey for medical students, moving beyond some of the traditional methods towards training that is much more personalized, much more interactive, and really focused on practical application.
Yeah, by bringing in tools like these intelligent tutors, the virtual simulators, adaptive learning paths, the goal seems clear.
Which is?
Helping students move beyond just memorizing facts to truly understanding and applying complex medical knowledge, equipping them with both the skills and, importantly, the confidence they need to excel.
And this transformation in how students prepare, it really promises a future generation of healthcare providers who are not only incredibly knowledgeable,
Yeah.
but also more prepared, more confident, and ultimately more capable of providing that high-quality, compassionate care we all want. It feels like a vital step towards a healthcare system that is, as the sources say, intelligent, adaptive, and deeply human-centered.
That's the vision, yeah.
So thinking about this blend, this mix of cutting-edge technology and that essential human connection, maybe consider this. How might this combination fundamentally redefine what it means to be truly prepared to care for others in the future?